Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the nonoperative treatment of adult scoliosis. Adult scoliosis involves rotation and curvature of the spine due to degeneration. It is very different than pediatric or adolescent scoliosis. It's often painful, it's typically stiff, so it's not responsive to a bracing, and it often causes both back and leg pain. Those are very different than younger folks who have flexibility, so they respond to bracing. It's usually not painful in kids, and usually kids don't have back or leg pain. Why does adult scoliosis occur? There are two reasons. One is if you had scoliosis as an adolescent and it's over 40 degrees once you reach skeletal maturity, usually it gets worse at an average of 1 degree per year. It doesn't sound like a lot, but if you're 40 degrees at age 18 and then 50 years later you're 68 years old, that your curve might be around 90 degrees. So it can get to be pretty severe. Now the other way that can occur is that you didn't have it as a kid and it just occurs new due to spinal degeneration. You start to have some disc degeneration when you're younger, then that pushes the stresses of the spine back to the facets in the back and they get arthritic, and then you can start to get asymmetric arthritis, and eventually it leads to a curve, and that can start to pinch on your nerves, so you can end up getting back and leg pain. So you can see a curve here in an adult, but think about it. The nerve roots are coming out here, here, here. See how little room there is because there's, basically closing down in this concave area. So the arthritis from the facet degeneration can lead to back pain and muscle weakness and aching because it's tough to stand up straight. And then you can get spinal stenosis where the nerves get pinched over here, so that's what can lead to the leg pain. What are the treatments for adult scoliosis? Well, there's quite a few of them actually, non-operative. Over-the-counter medications such as anti-inflammatories and Tylenol. Prescription medications, which may include higher strength anti-inflammatories like Celebrex. Neuropathic medications can help a lot, such as Neurontin and Lyrica. Narcotic medications may be very helpful, and they don't have to be given all the time. They can just be short-term for when exacerbations occur. Topical prescription pain creams and patches can be very beneficial. Physical therapy can help. It can help strengthen up muscles around the spine. Interventional treatments are really helpful. Here's one, facet injection. So for all these arthritic joints in the back of the spine, you can actually inject right into that some numbing medicine and some steroid. That can stick around for weeks to months and provide pain relief, and you can actually have that treatment in multiple joints. If you're having spasms and aching, then trigger point injections can help with those. Here are some other treatments. Medial branch block. Instead of having the needle go into the facet joints, they can actually go around the facet joint, and numbing medicine can block these little sensory nerve endings called the medial branches, and that can give immense pain relief for months at a time. Okay. Now, if those work and then wear off, you can go on to have a radiofrequency ablation. So see how it looks like the needle's going in the same place? It is, but it's not really a needle. It's called like a little catheter. And what that catheter's doing is it gets heated up with thermal energy, and it deadens those little medial branches for 6 to 18 months. Okay? Now, for spinal stenosis, where you have nerve roots getting pinched, epidural steroid injections are the gold standard for those. So between these treatments, you can get a lot of help for your back pain and your leg pain. What are the outcomes? Well, over 90% of those with adult scoliosis can achieve a satisfactory level of baseline pain without surgery. Surgery is elective. It's a quality of life procedure. It should absolutely be a last resort. Now, surgery can take 8 hours. It could be set into 2 days, 5 or 6 hours each time. Okay, but either way, it's a long procedure and it's a lot of rehab, 6 to 9 to 12 months. It can involve this much hardware, or it can be hardware from here down. But either way, there's just a lot of instrumentation put in place. Adults simply do not tolerate these types of surgeries like you do when you're a kid. Okay, there's over a 50% complication rate. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state, including in Austin, Texas, accepting over 50 insurances and providing over 25 different treatment options with the board-certified physicians. Visit us online today. for Austin treatment at painmanagementaustintx.com, and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.